Hello, welcome again to the Libertarian Solution videocast. I'm Nick Coons, and I have another email question from a listener here. He writes in, while I'm a strong supporter of the Libertarian Party, I'm a bit torn on this healthcare bill. I'm a type 1 diabetic, and I am currently uninsured due to my, quote, pre-existing condition. Insulin is about $130 a bottle, testing supplies are about $1 a piece, and I go through about 8 a day. That doesn't even include my pump supplies and repairs that run me into the ground. I need a medical plan that will help me with these supplies and medications. I can't get one unless I or my wife get a job with a medical plan, and I will still have to wait a year because I'm uninsured now. I hate big government. I hate any government, but the pharmaceutical companies sell their meds for a year's worth of salary in one buy. I need help. What do I support? How do I decide between liberty and life? And that's a good question. It's kind of a tough question too. Reminds me of a Harry Brown quote when he said, "Government is good at one thing. It knows how to break your legs, hand you a crutch, and then say, 'See, if it weren't for us, you wouldn't be able to walk.'" So we have to look at what it is that's costing so much money here. Why is it that someone who has type 1 diabetes might have difficulty affording the supplies or getting coverage to be able to help with those costs? The first thing to look at is the cost of the supplies themselves, the medication, the insulin, the pump supplies, and things like that. And those costs can pretty much be attributed to the FDA. To get something to comply with FDA regulations, it takes about 10 years, and it costs about $800 million. And it can contribute upwards of 85% to the cost of drugs and anything that that needs FDA approval, such as the insulin pump, and the various other supplies. And we see that a lot of this testing is unnecessary. Obviously, you want to test stuff, you want to make sure it's good and it's quality and all that other good stuff. And of course, even from a just a free market perspective, from a pharmaceutical company perspective, you don't want to go out and put stuff out there that are going to kill your patients because they're your customers. Or that's obviously not good for business. You want something that's going to make it so people will live. So if you are building stuff that's not safe, then you're not going to be around very long. I mean, even if the stuff that you make is unsafe one time, people in the future aren't going to trust you to make drugs anymore, to make medical supplies, or to make anything else. You're going to lose any credibility, and you won't be able to manufacture anything that anybody's going to buy. So, but we can also see this because in places like the UK, it's a lot less expensive and a lot less time-consuming to get drugs approved and drug supplies approved. And they, those things over there save lives while they're illegal here because they haven't gotten FDA approval. So we know that the FDA approvals process is unnecessary for the most part. A large part of it, the testing is just outrageously expensive and very long-term, more than it needs to be. So we could cut the cost of things way down if we didn't have to require FDA approval for everything. And maybe something like an underwriter's laboratory, which handles electronics. If you look at the back of maybe like your television or on your computer or stereo equipment, you're probably going to see a stamp that says UL on it, and that's Underwriter's Laboratory. And they certify electronic equipment. They're not a government agency. They're completely private. And major retailers, Walmart, Kmart, Target, things like that, aren't going to want to sell electronic devices unless it has some kind of certification on it saying this isn't going to explode on you. This is a safe product. It's not going to blow up while you're watching. TV's not going to blow up while you're watching it. So they want to make sure that that the stuff that they sell is going to be safe for the consumer, and so they require certification. So the manufacturers of the equipment will go to places like Underwriters Laboratory, UL or CE or whatever other certification houses there are out there, and they'll go through and they'll do independent testing on it to make sure that it's safe, and they'll put their stamp of approval on it. Now, the customers of Underwriters Laboratory are the manufacturers of the products. And you would think, oh, well, maybe just Underwriters Laboratory will just put their stamp of approval on anybody who gives them enough money. Well, that's not really true, because what UL has to sell is their name. If they start stamping everything from everybody who pays them, then they're going to end up stamping products that are no good if they haven't tested them. And then the products are going to be unsafe, and consumers are going to be hurt by them. And so the UL sticker won't, or stamp of approval won't mean anything, and manufacturers will stop seeking it out because it won't help anything, because major retailers will not look at the UL certification as a means to know whether or not something is safe or good. So manufacturers won't seek it out anymore, and that'd be a very short-sighted approach for UL. If they want to remain in business for a long time, they're not going to do something short-sighted like that. They're going to make sure they're only passing through quality products, which would be a perfect setup for the FDA. If we spun the FDA off into a private entity and made it so it was a voluntary certification process, they of course would have to be inexpensive, they'd have to be fast, they'd have to have actual testing processes that make sure that things are good, because of course being private they could have competition. You could have someone competing with the FDA. You know, they could say we do just as good of a job as the FDA or better at approving the quality of something without costing as much, without taking as long. And of course, if you're the manufacturer of something, you would want to, have the least expensive method of doing it. You'd want to have the fastest method of doing it to get your product out to market. So competition would make sure that the certification houses provided the best the best possible testing at the least possible price. That would really be the way to solve that problem. And right there would drop the prices of drugs and drug supplies and medical supplies and anything that currently requires FDA approval, drop it way down. In some cases, like I said, up to 85% of the cost would end up going away. So that's one big thing right there. The second big thing is regulations on insurance companies, and they cause insurance companies to reject people due to what they call pre-existing conditions. The state legislatures require that insurance companies basically cover a whole slew of things when you get insurance. You can't get insurance for one specific thing. You can't get a la carte insurance. You can't get just catastrophic insurance. You can't get just insurance against cancer, those sorts of things, because the states mandate to the insurance companies that if you're going to provide someone insurance, you have to cover these sets of things. Now, of course, every state is different, but every state has them. Some states you'll find that they're better, some states you'll find that they're worse, but for instance, if you're in California, your insurance has to cover marital counseling. Well, of course, if you're single, that doesn't do you a lot of good, but you've got to pay for it anyway. So the insurance companies are going to reject you if you have a pre-existing condition, because the mandates are going to require that condition be covered. So if you could get insurance that would exclude your pre-existing condition and still cover you for other things, for cancer or any other kind of emergency services, that would be a way to get insurance and not have to worry about your pre-existing condition causing you not to be able to get coverage for other things that you don't have but are just as unlikely to get as someone who doesn't have your pre-existing condition. So that would be the way to go to cover the ability to get insurance. Would be to remove the mandates that the states impose on insurance companies. And of course, the easy way to get around that, if the federal government wanted to get involved, would be to remove the requirements that you can only buy insurance regulated by your state. So for instance, I'm in Arizona and I can only buy health insurance in Arizona. If there's some really nice plan in Utah, for instance, that I thought would be good, or in Wyoming, that would cover my needs the way I want to, it's illegal for me to buy it there. I wouldn't be able to do that. So the federal government could remove the restrictions that you can buy, that you can't buy insurance out of state. It'd be nice if you'd be able to buy insurance anywhere. Why not? I can buy anything else pretty much anywhere. Why can't I buy insurance anywhere? So if you could do that, the state legislatures would have to remove the mandates. Otherwise, states that have strict mandates, like California, their insurance companies wouldn't be able to survive. They'd have to move, and California wouldn't want them to move because they'd lose the tax revenue and all those sorts of things. So they'd have to get rid of the restrictions there. So that'd be the way to approach it from the federal level. Now, looking at this specific situation practically, the government really needs to get out of healthcare completely. I mean, that's really the only solution to it. But we know that's not going to happen, which means really the only way that, solution that you might have that applies to your specific case that'll help you take care of the expensive supplies would be a public option. Might be the only affordable way for you to get your supplies, because we know that the correct solution, the government getting out of it, probably isn't going to happen. They've got their fingers in everything in terms of healthcare. There's no reason for them to get out of it. There's not enough of a public outcry for government to get out of it. There's a lot of people saying we want a public option, so we want government to be more involved. We want them to regulate the insurance companies even more, regulate the pharmaceutical companies even more, which of course will have the exact opposite effect of what we want. Things are just going to get more expensive, and you're going to have waiting lines, and so I don't know if there really is a way to solve this in terms of being practical about it, in terms of what the government will actually do, because we know they're not going to do the right thing. Even with the public option, it's going to be a very short-term solution, because it might turn out that there'll be a waiting line for your medical supplies, because of course public funding of something like that's always going to lead to rationing, like it does everywhere else that this exists. So really, We need to understand that government control of healthcare is what put you in the position that you're in now, unfortunately. And not a whole lot we can do unless we understand that that the government's the one that caused this. It's not the pharmaceutical companies. So the way you can consistently support both life and liberty is to advocate government dropping the reins completely and turning them back over to you, the consumer, so that you can make your healthcare choices. So there's a slew of companies who are willing to provide you with the products that you need that aren't being regulated to death by the government, and the costs are going to go way down on something like that. So I hope this has been helpful for you, and for anyone else who's listening, I hope it's been helpful as well. Of course, don't forget to tune in to the Libertarian Solution radio show. Check out libertariansolution.com, and we'll see you next time.